One of the studies we've recently published, which has been led by one of the members of my team, Dr. Ben Smith, is looking at men's understanding of what their choices are if they're diagnosed with an early prostate cancer. So in fact, we know that if they have surgery or if they have radiation oncology as their treatments, the outcomes are equivalent. But what is important for men is things like what are the side effects, how long does the treatment last, what they perceive to be are important choices for them. So we did a study which asked them, what they'd considered in terms of the robotic prostatectomy versus radiation oncology treatment, what they understood about the two treatments, what information they'd been given by the two different types of providers, and so on, but also what was important to them in making a decision between the two. What we found was that men didn't feel terribly well informed about what the other option was. So if they'd spoken to the urologist, for example, they would tell them about the robotic prostatectomy, but less so about what the other options are, and the same in the other direction. So they felt that they really wanted to know full information about both to help them make that informed decision. So in the process of that study, we actually, with the cancer centres that were involved, we established a combined clinic where men who were possible for robotic prostatectomy had to actually go to the clinic and meet with the urologist as well as with the radiation oncologist to discuss both options fully before they made their decision and before they were able to have the robotic prostatectomy or the radiation therapy at that particular centre. And we're now moving on to another study which was a flow-on from that, to where we've developed a question prompt list to help men actually identify what questions they want to ask of both practitioners to help them make that very informed choice. So that study is running right at the moment.